Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's webinar is part of our Nutrition During Cancer Treatment Education series, a special collaboration between the Blum Center and the Mass General Brigham Cancer Institute. Before we get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has music, so can hear our guest speakers today. If you have any questions for our guest speakers, you may use the chat feature, which is located at the bottom of your screen. We'll have time from the end. Only Blum Center staff and our guest speakers will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to complete. Your feedback is important to us as we plan future programs. All right, so next I'm going to turn it over to Taylor Klein, who will get us all started.
Thanks so much, Amy, for that introduction. And thank you to everyone for taking time out of your day today to tune into the next session of our Nutrition During Cancer Treatment Education series here. My name is Taylor Klein, and I'm a clinical dietitian here at Mass General Brigham Cancer Institute. I'm so happy to be here with my colleague, Martha Silva, who has been leading this educational series. Martha is a clinical dietitian also at the Mass General Brigham Cancer Institute and holds specialty certification in oncology nutrition. The webinar today focuses on management of diarrhea during cancer treatment, as it is part of a series of navigating symptoms that may become a barrier to adequate nutrition in the context of cancer treatment. I will be assisting with the presentation of material, but will also moderate the chat and help facilitate a Q&A upon completion of the presentation. Without further ado, please help me welcome Martha Silva.
Awesome. Thank you so much, Taylor. Are those slides showing up for you both?
Yes.
Great. So as Taylor shared, today we're going to focus on managing diarrhea during cancer treatment. Here is our agenda. I'll start by giving a brief overview of nutrition during cancer care, and then we'll discuss diarrhea, how we assess it, what we can do about it, both from a dietary standpoint, as well as with some other interventions. Taylor will wrap up the discussion of the other interventions, and then to conclude, she'll share some practical tips and tricks. Nutrition and cancer care. If you've attended any of our previous webinars, you probably know by now that our team of registered dietitians works with patients, their families, and their oncologists to help manage the side effects of treatment, including diarrhea, which will be today's focus. This approach also can involve developing individualized diet and hydration plans. In this context, we would be looking at fluids with electrolytes to help replace some GI losses from loose stools, potentially recommend oral nutrition supplements that can help. And then we'll also touch on tube feeding support at the end for anyone tuning in who is on enteral nutrition. Why might diarrhea occur during cancer treatment? In many cases, diarrhea is related to the treatment itself. Certain surgeries, such as cholecystectomy, gastrectomy, Whipple procedure, and really any intestinal resection may affect normal bowel function and contribute to diarrhea, particularly as the body adapts to its new anatomy. Chemotherapy, immunotherapy, and radiation to specific sites listed here are all associated with diarrhea. Patients who have received a bone marrow transplant may also experience diarrhea if they develop graft versus host disease, or GVHD. And this is because GVHD often impacts the GI tract. Supportive medications like antibiotics, tube feeding, stress and anxiety, and infection may also be at the root of diarrhea. The National Cancer Institute uses a grade system to assess diarrhea that evaluates number of stools per day, incontinence, increase in ostomy output if an ostomy is present compared to the individual's baseline. Interference with activities of daily living. We'll often hear that some people are afraid to leave the house to go to the grocery store or run other errands because they're concerned they may need to go to the bathroom while they're out. And finally, hospitalization. Grade 1 diarrhea is an increase of less than 4 stools per day over baseline. Grade 2 is an increase of 4 stools per day over baseline, and so on. Left untreated, the impacts of diarrhea may be severe and even life-threatening. Luckily, management is often possible. So we'll start with some dietary approaches to management that may help lessen the severity of diarrhea. First, we recommend limiting or avoiding food that may worsen diarrhea. Caffeine, alcohol, and food that's spicy, fried, or greasy can irritate the lining of the GI tract. Next, foods high in insoluble fiber can also irritate this lining, and they tend to draw water and mucus into the bowel, which can make the stool loose and even leaky. Insoluble fiber is the roughage in foods like dried fruit, salad greens, apple skins, and potato peels, among other plant foods. For some milk and dairy products that contain lactose may be problematic. Lactose intolerance can arise during cancer treatment if the body's production of lactase, the enzyme that breaks lactose down, is disrupted. So for these individuals, low lactose or lactose-free alternatives may be beneficial. And finally, sorbitol and other sugar alcohols may be problematic because they're poorly absorbed and can draw water into the bowel. On food labels, sugar alcohols often end in ITOL, for example, erythritol, xylitol, and mannitol. Next, we recommend eating more foods that may be well tolerated. Unlike insoluble fiber, soluble fiber breaks down in water and forms a gel, and so this can help absorb water in the gut and slow the movement of food through the GI tract. Fruit high in soluble fiber includes applesauce, bananas, canned peaches and pears, citrus, and mango. Peeling and removing stems and seeds from vegetables, but also from fruit, can help reduce insoluble fiber content, as does the cooking process. So many of these items can be suitable if they've been cooked and peeled. Oatmeal and other simple carbs are also good choices. You may notice that a lot of high soluble fiber foods are part of the traditional BRAT diet, which stands for banana, rice, applesauce, and toast. But the core BRAT diet is quite restrictive, and there are a lot of other items that are safe to consume during bouts of loose stools. Bland proteins like baked chicken or fish, eggs, plain protein powder mixed in water or with frozen fruit to make a smoothie, yogurt, and these other options are all typically pretty well tolerated. Dehydration is a major concern, and because of increased GI losses, it's important to aim for around 8 to 10 cups of fluids daily, with an extra 1 cup for each loose bowel movement. Additionally, fluids should include electrolytes. Sodium, potassium, and magnesium would be 3 of the big ones. Commercial options include things like Pedialyte, Gatorade, Liquid IV. Coconut water is an excellent source of potassium, and broth or salty foods can provide sodium. We also included here a recipe to make your own homemade rehydration solution. This one includes 3/4 cup of coconut water, a 1/4 cup of fruit juice or lemonade, and then a pinch of salt. Usually just under an 1/8 teaspoon is a good amount for that fluid volume. There are also a lot of other recipes online. If you Google things like Nature's Gatorade, there are some great ones out there. For many with diarrhea related to cancer and its treatment, other interventions are necessary as well. First, we recommend going through your medication list with your healthcare provider to understand whether any meds might contribute to diarrhea. Many of these things like antibiotics and antihypertensives are necessary, and people will need to continue taking them. But certain bowel medications like stool softeners, laxatives, and prokinetic agents may be something patients can omit following discussion with their healthcare team. The team may also recommend medications to help, such as opioid receptor agonists like Imodium and Lomotil, octreotide for diarrhea associated with neuroendocrine tumors, anti-inflammatory or anti-diarrheals. Pepto-Bismol is an over-the-counter option. Bile acid sequestrants if diarrhea is related to malabsorption, lactase for lactose intolerance, and finally, pancreatic enzymes for patients with pancreatic exocrine insufficiency. So as you can probably see, a lot of these medications to help really depend on what the healthcare team decides is the root cause following workup of diarrhea. And I'll now hand things over to Taylor to discuss a few other interventions.
All right, thank you. Another intervention for diarrhea is the use of soluble fiber supplements. Common brands of this type of fiber are Metamucil or Citracel. Metamucil is made up of a soluble fiber called psyllium husk, and Citracel is made of soluble fiber methylcellulose. Both soluble fiber supplements may help improve the consistency of the stools, slow the transit rates, and decrease the urgency, resulting in more formed stools and less frequent bowel movements, similar to the food sources Martha talked about earlier. It is recommended to incorporate soluble fiber supplements after meals. So starting with 1 teaspoon of soluble fiber powder and 2 ounces of cold fluid like water or juice, or consuming 2 psyllium fiber wafers, specifically referencing the Metamucil fiber thins. They recommend taking this mixture once a day after meal and gradually increasing as needed up to 4 times a day after meals. A slow advancement of the soluble fiber supplementation is encouraged to optimize tolerance to the added fiber in the diet. The slow advancement should limit abdominal distension, gas, and bloating from the added fiber. There are a few limitations to using soluble fiber supplements after meals. We want adequate hydration to achieve the full benefit from the soluble fiber, as it dissolves in fluid along the GI tract and forms a gel-like structure to form the stools. And with the tips described today, hopefully adequate hydration can be met more regularly in the setting of diarrhea and pose less of a limitation. Additionally, we recommend discussing the addition of a soluble fiber supplement with your medical provider or registered dietitian, as you may need to separate the fiber supplement from the time you take certain medications or supplements. Next slide. Moving on to probiotics, they are another intervention for diarrhea. These are live microorganisms like bacteria and yeast that can provide beneficial health benefits when consumed by the host in sufficient amounts. These types of microbes are found naturally within our gut microbiome, and the consumption of specific probiotic foods and strains of bacteria can help support those overall beneficial microbes in our gut. In the case of chemotherapy and radiation-induced diarrhea, probiotics can help restore gut microbiome and encourage regular bowel movements. Food sources include yogurt, kefir, cottage cheese, miso, kombucha, sauerkraut, kimchi, and pickled vegetables. Each of these foods have in common a fermentation process that help encourage probiotic development in the food. A note to be mindful of is when including sauerkraut, kimchi, and pickled vegetables during active diarrhea. Be mindful of including them in active diarrhea as they're higher in that insoluble fiber and may be less tolerated at that time. There are 2 beneficial strains of probiotics that we know of that have been studied in diarrhea during cancer treatment. However, this is an emerging field, and future research is warranted to recommend a dosage and regimen for the use of the probiotics in this setting. So speaking with your medical team would be a great place to start. There are a few contraindications and limitations to consider when discussing probiotic supplements in this setting as well. We always want you to discuss with your medical provider before starting a probiotic supplement, as it may be contraindicated when immunocompromised during cancer treatment due to the infection risk from active cultures, or may be contraindicated while undergoing immunotherapy treatment, as probiotic supplements may reduce the effectiveness of the treatment by reducing the overall microbiome diversity from a single probiotic supplement. That also tags on to the limitation of current probiotic supplements, as they contain 1 or several strains only of specific probiotics without that broad range that we get from a diet in 1 capsule. So the recent studies suggest that taking a single strain or set series of strains for a long period of time may not be as beneficial as we once thought due to its impacts on reducing that overall gut microbiome diversity. Additionally, avoid opening probiotic capsules if you or your loved one has a portacath for venous access, given infection risk from active cultures. And amino acids are building blocks of protein, and it's another intervention for potentially for diarrhea. Most specifically, there are 20 types of amino acids that the body uses, but glutamine is one of the types of amino acids that is a major energy source for rapidly dividing cells, which line our entire GI tract, and plays a role. The glutamine plays an important role in the overall gut integrity. It has been studied for its potentially useful properties in healing the GI tract lining after chemotherapy-induced damage. But most research at this time has found that glutamine supplementation could reduce the duration of the diarrhea, but it could not improve its severity. Enterade is an oral nutrition supplement fortified with amino acids, specifically to support reduced GI side effects associated with cancer treatment, like nausea, diarrhea, dehydration, and weight loss, some of the things we've talked about in this series. It contains amino acids, aspartic acid, valine, serine, threonine, and tyrosine. It's suggested to drink 2 8-ounce bottles of this drink daily to improve symptoms. And research using Enterade shows improvements in overall bowel quality with consumption of this fortified beverage, but some evidence is limited by participants' ability to comply with a recommended regimen of 2 8-ounce bottles a day. Moving on to additional practical tips and tricks. We'll first look at a typical day of eating, and it starts with small, frequent meal structure that focuses on low fat, low insoluble fiber, or less roughage, and low lactose foods. It emphasizes soluble fiber foods and gentle protein sources. So we have at 8 a.m. oatmeal with peeled apple slices. Peeling the apple slices removes that insoluble fiber and retains the soluble fiber in combination with the soluble fiber from the oatmeal. At 11, we have some peanut butter with banana on sourdough bread. And this is another no dairy option with nourishing banana and calories and protein from peanut butter. At 2, some clementines and crackers. The clementine could also be swapped for canned peaches or pears in their own juice based on one's preference. At 5 p.m., there's baked chicken with rice and well-cooked peas. This meal incorporates a gentle protein, carbohydrate, and vegetable to encourage adequate nutrition and limiting triggers to diarrhea. And at 8 p.m., we'll round the day with a popsicle to focus on some hydration and just settling for bed. We also want to remember to hydrate to replenish the fluid loss through diarrhea. So some tips to help encourage fluid intake would be increasing interest in hydrating fluids by flavoring water with a splash of juice or citrus like lemon or herbs like mint, switching it up to a sparkling beverage for variety, or incorporating warm beverages like tea or broth, which can be quite soothing. Aim to start fluid intake in the morning and keep a bottled fluid nearby all day to take frequent sips. Keep that physical reminder of having the bottle with you may help reach your fluid goals, and that way you're kind of spacing it over the whole day as compared to trying to cram it all in the evening or at night. Another way to encourage intake is to fill a pitcher with goal fluid intake, so that 8 to 10 cups per day. Starting your day off with that in a pitcher and pouring from the pitcher into individual glasses throughout the day to keep track of where you're at in your intake. We can also set reminders on our smartphones to remind oneself to make a drink or take an extra couple sips. But I also like to make a routine of it. If you're watching a show and there's commercials, or you get a text or you get a call, can we have an extra sip after each of those events during the day? Be mindful of caffeinated beverages such as coffee or tea, which may also worsen the symptoms of diarrhea due to the caffeine content. And we also wanted to make sure to include special considerations for tube feeding. Tube feeding is used to support adequate nutrient intake when oral intake is not feasible. And first are considerations related to the type of formula one is using to meet their nutritional needs through tube feeding. So the protein source of the formula can be altered from milk-based, plant-based to broken down amino acid-based, which may affect digestibility and symptoms of diarrhea. The concentration of the formula affects the nutrient density per ounce of formula provided and may impact diarrhea symptoms at higher concentrations. The fiber content of formula may affect the stools, as we mentioned throughout this presentation, and we can modify this in tube feeding as well by selecting a fiber or fiber-free formula. Additionally, identifying any nutrient intolerances like lactose prior to starting tube feeding might help guide the tube feeding formula choice with the dietitian and the patient and limit any symptoms of diarrhea from being onset. The method of administration can also be adjusted to encourage a reduction in symptoms. The modalities of tube feeding are syringe, gravity, and pump, and each providing more control over the total volume and speed of the tube feed provisions provided at one time, which can help control tolerance. This leads me into my next consideration as well, where speed is really important, and slowing the rate of infusion can support more digestive time and reduce the overall symptoms of diarrhea. Similar to oral soluble fiber supplements, banana flakes have been specifically formulated for tube feeding, and the suggested use is included on this slide. It's important to note that it's not uncommon at the initiation of tube feeding for someone to experience loose stools while the body is adjusting to a more liquid forward diet. But speaking with a registered dietitian can help adjust one's tube feeding routine to find the best routine for you or your loved one. And of course, to get more further individual guidance for you, we recommend patients at the Cancer Institute to schedule appointments with our team of registered dietitians by requesting a referral from their oncology providers. And we care for patients at Boston, Danvers, Newton Wellesley, Waltham locations, and we have some opportunity for virtual visits as well. These are our resources. And thank you all for listening to Managing Diarrhea During Cancer Treatment. We hope you've been able to glean some new information into the nutritional management of diarrhea and expand upon the classic brat diet, bananas, rice, applesauce, and toast, to encourage continued diet variety and optimal nutritional intake during cancer treatment. And now on to some questions with Martha.
Awesome. I can take the first question. I see there are a couple in the chat already. So one is, can drinks like Pedialyte help to stay hydrated? Absolutely. Ideally, because of the increased losses of electrolytes through loose stool, we would want some of those fluid needs to come from fluids with electrolytes, and Pedialyte is a really great option. The sort of mechanism through which electrolytes are lost during diarrhea is that intestinal time for transit is a lot faster, so the colon doesn't have as much of an opportunity to suck those electrolytes back in, and they get lost. And so Pedialyte, Gatorade, Liquid IV, broth, coconut water, all fantastic choices. Looking to see, I think that's the only question at this point. I did want to raise a question to get Taylor's input. This is something that people often ask us in clinic, is whether or not the dietary approaches to management will be helpful before diarrhea presents.
Yeah, typically, want you to keep your normal routine of eating, as you're feeling well, but with the onset of symptoms, it would be great to shift that diet into more of these soluble fiber, more gentle foods to help control the symptoms that have started. So no need to start it way in advance. It won't affect it in the time of the diarrhea.
Awesome. Thanks, Taylor.
Yeah. I had a question for you as well. Do you have some recommendations for foods that are low in lactose or good lactose-free alternatives for diarrhea?
Yeah, that is a great question. I would say yogurt generally is naturally going to be low lactose, so people don't need to go straight to a plant-based yogurt out of the gate unless they have a broader dairy intolerance or are on a plant-based diet. So I would just start with plain Greek yogurt to get some extra protein. If that's irritating, there are some oat, almond, coconut, and soy-based yogurts that could be a next step. Hard cheese is pretty low in lactose too. That shouldn't cause a major issue if it's being eaten alone. I would avoid any fried cheeses that might be a little more irritating. Oh, and it looks like we actually got another question in the chat. Which types of drinks are most tolerable for nausea? I could take this one. For For nausea, usually clear liquids are the least irritating. So that could be any of those electrolyte-rich drinks we discussed already. Sometimes tart sour flavors sit really well too. So that's where something like a lemonade mixed with water might be nice if the acid isn't too irritating to the mouth. I don't know if you'd add anything to that list, Taylor.
I don't think so. You've done your nausea presentation on this
Yes.
series as well, so we'll just put a promo in for that video too. That'll be available. That is already probably available on the Blum Center website. Looking up nausea as part of this series, and you should have some other additional recommendations as well.
I will say too, dehydration can exacerbate nausea. So that list of strategies Taylor suggested to increase interest in fluids is a great tool. Just carrying fluid with you in, a bottle on the go, or setting a schedule of reminders to stay hydrated can really help. All right, I'm not seeing any other questions, but we'll give it one more minute just in case anyone wants to add something else to the chat.
Thank you. And while we wait, I'm going to enter in the chat for everyone, save the date. Our next session will be on managing constipation during cancer treatment. It's going to be held on Monday, April 6th, also at noon. I included the website to the Blum Center where you can view the schedule, upcoming information on that, as well as Zoom links to attend, as well as our previous webinars that have been recorded. So if you visit that website, there's a link that says watch past webinars, and from there you should be able to watch our recordings, see our recordings. All right, so I don't believe there are any additional questions in the chat, so it'd be fun to end a few minutes early before we end today's session. Taylor, Martha, do you have any final thoughts you'd like to share with the audience?
I don't think so. I'm hopeful that the managing constipation talk will be a nice complement to this one, because I do find a lot of people say they oscillate between constipation and diarrhea during treatment. So hopefully that will address the other side of the coin.
All right, well, thank you. Martha, Taylor, thank you so much for your time. For everyone who joined us today, thank you so much. As I had mentioned, today's session is being recorded. You may visit the Blum Center website. It should be available within 2 to 3 weeks on that website. Thank you so much, everyone.
Thank you.
Take care.